My name is Madison. I'm a student nurse with the University of South Alabama. This is going to be my NG tube checkoff. Here is my student ID, and then I'm going to do my room scan. Okay. Okay, so first things first is we would walk into our patient's room. We would check our chart. It's for Jaguar Jones, and this is Jaguar Jones. We'd use a second identifier, state of birth, 8/25 of 1963, 8/25 of 1963, and then we would double check our order, and we see that we are inserting Salem sump and connecting to low intermittent suction connected to the wall. So after we have verified our order and our patient, we would explain the procedure to the patient. We would get them all set up. We would place a towel over their chest for any secretions. We would hand them a cup of water with a straw, and we would connect a pulse box to their finger, turning it on, of course. And then we would give them a tray just in case there's any secretions during the procedure. So then we would raise up the bed and lift it into high Fowlers. We would perform our hand hygiene, and we would put on our clean gloves. At any time during the procedure, if the patient's vitals drop or increase by 20, we would stop the procedure and reassess till vitals became normal again. We would also establish a queue with the patient before we began the procedure, ensuring just in case there was an emergency during the procedure, if he needed us to stop, we would have that queue set up so we could stop. Okay, so we would also prime our syringe. All right, and we would open our NG tube, open some lubrication, water soluble, and squirt it on the package and throw that away. And I have also already got my tape cut out, and we would also apply our goggles at this time. Okay, so then we would take out our NG tube, our Salem sump, and we would coil the tip around our fingers. We would be doing this to ensure it's easier to bend for insertion. It'd be more comfortable for the patient. We place the end of our tube in the container, and we would, well, before we did that, we would measure it out on the patient. Can you have a second? Okay. So we would measure it by, can you face the camera? Starting at the patient's nose, and then you would measure behind the patient's ear, nose to ear, and then down to the patient's xiphoid process. Normally this would be done without the patient's shirt on, but for the purpose of the video, we'll just do it that way. And then we will get our dog-eared piece of tape and place it. And then we would have rolled our tube 2 to 3 inches in lubrication. And then we would also have had the patient assess their patency in each nostril, which would be placing one finger on the nostril to ensure which nostril would be best for insertion. In this case, we decided on the right nostril. And we've already lubricated, and the water is here. We would instruct the patient to take a sip, and every time the patient would swallow, we would insert the tube 1 to 2 inches. And also, while we are inserting the tube, once again, if the vitals drop 20 or increase 20, we would stop the procedure, retract the NG tube to the nasopharynx, and wait till vitals return to normal, and then we would start again. Till the patient wait till the vitals return to normal and the patient can breathe, then we would start again. So upon insertion, we would have the patient tilt their head back, and then we would start to insert. And as we insert, we'll be rotating the tube 160 degrees. And after we pass the nasopharynx, we would have the patient tilt their head forward. Okay, so you would insert up until the tape, and then you would get another piece of tape and adhere the Salem sump tube to the patient's cheek. Okay. And at this point, you would then ensure that it was placed correctly by I want to say decompressing, but I feel like that's not the right word. Pressing down on the patient's tongue and shining your pen light to the back of the throat to ensure that the Salem sump tube is in the correct placement. And now that's in the correct placement, we would then verify by connecting, and we would aspirate the gastric contents, which is one form of checking. Another form of checking that the tube is placed correctly would be a chest x-ray, as well as checking the pH. Okay, so after that, we would either cap the Salem sump tube, but in this case, we would be applying it to intermittent wall suction. So we would apply to the intermittent wall suction. And we would also ensure that the blue pigtail is above the patient's stomach, and we would then clip the NG tube to the patient's gown, still ensuring that they had enough space. Okay, and before we were finished, we would also lift the pressure off of the nares by connecting this next piece of tape to the top of their nose. Oops, took some of the paper with it. And then attaching that to lift some of the pressure off of the nares of the patient. And we'd also throw away that extra tape, and you would take an insoluble marker and mark the NG tube where that tape was, so when you check on it in the future, you can ensure that the NG tube has not moved in or out and it's still in the correct placement. You would also take a final piece of tape and place it over the patient's nose. And once again, with your marker, you would write the time that it was placed, your initials, okay. Then you would clean up your space. Return the patient down to the lowest bed setting, ensuring not to drop the head of the bed below 30 degrees. And Then you would document the type of tube that was used. In this case, we used a Salem sump. You would document if there was any secretions, the amount, type, color, consistency. You would document the placement, how you checked for placement correctly, and you would also document that it was attached to low intermittent wall suction. And that would conclude the insertion. So then to remove the NG tube, you would once again check the patient, Jaguar Jones, date of birth 8/25/1963, 8/25/63. Then you would verify the order, that it was time to get the NG tube, the Salem sump tube removed. Okay, so after we verified our order, rechecked our patient, we would raise the patient back into a working position, and then we would osculate. We would be listening for vowel sounds. And then we would perform our hand hygiene, and then we would don our clean gloves. Then we would turn off the intermittent wall suction and detach our tube from the suction. And then we would also remove the tape from the patient's nose. And then we would instruct the patient to take a deep breath and hold it as we removed the NG tube, coiling it around our hand. And we would also have unclipped it from the patient's gown as well. And then we would remove our gloves. That way. Then I would don another pair of clean gloves, and I would perform oral care on the patient, and then I would remove those clean gloves as well, and then I would document what time we removed the NG tube, the type, which was a Salem sump, if there was any secretions, the amount, type, color, consistency, and then I would also document that the patient was no longer attached to suction with the NG tube as well. And that concludes my NG tube checkoff.